going on? Doesn't sound right. I can't see with my glasses on.
Yeah, we should be all set. So just let me double check. Yep, we're all set.
There.
You're all set.
Okay, so
Okay,
is
great,
it
thank you.
Sandra or Sandra?
Sandra.
Okay, so Sandra Sorensen, who's the executive director of NAMI Finger Lakes, will be our guest. That's pretty much first on the agenda. So maybe we'll get started with that first. But we'll go around and do some introductions so that she's a little familiar with who we are. I'm Jan Lynch and I'm the chair of the board this session.
Sheila McHenry, vice chair.
I'm Mary Hutchins, member of the. Jessica Connor, member of the board and mental health subcommittee.
Paul Zulu, member of the board.
Harmony Ayers Friedlander, Deputy Commissioner.
Frank Rupa, Commissioner.
Jackie Wunderlich, member of the board.
I'm Stu Bergman, member of the board and happy to have a key to the highway.
August Duplin, member of the board.
Anna Tamas, member of the board as well.
Sally McConnell, member of the board.
So that's everybody? Okay,
Oh, yes.
so we're happy to have you here today. We're very interested to hear what's going on with NAMI, so lead away.
So how many of you are familiar with NAMI? So most of you, so I'll skip through like a lot of the foreign stuff that you might already know.
You want to use this?
Yeah.
Just should be able to just advance with the arrow.
Okay, so NAMI is the largest grassroots mental health organization in the nation. There's over 600 local affiliates across the nation. Every state except for 2 have a NAMI. One of them is West Virginia. I don't know why. It's right next to NAMI National, but whatever. So we officially serve Tompkins and Cortland County, but the closest NAMI north of us is Cayuga County and then Syracuse, Rochester, Buffalo. There's nothing on the southern tier. So we get a lot of calls and referrals from people on the southern tier. Most of our programs are still virtual, so people can join in from anywhere. So I won't read through all this. You guys know how to read. In general, we do support advocacy and education for caregivers of people who are caregiving for people that have mental illness. We work closely with Tompkins County Mental Health, Mental Health Association of Tompkins County. So they serve peers. So we do a lot of similar things and we cross-refer to each other. NAMI as a national organization has taken on programming and offers programming for both peers and caregivers, but NAMI Finger Lakes has just adopted the caregiver side of it because Tompkins County is very rich in resources. So we don't need to duplicate what other people are already doing. NAMI Finger Lakes is a membership organization. So there are some benefits of being a member. All of our facilitators have to be a member. Yeah, membership doesn't really play into what we're trying to talk about today. Fast facts, you guys all know these. I think that NAMI is about lived experience. So the fact that I personally like to highlight is suicide was responsible for 48,183 deaths in 2021. I know 6 of those people. So that was a very hard year. My husband died by suicide that year, and that's my lived experience. I'm very open about sharing my stories. If you have questions about that, I can talk about that. Oh, that's a nice typo. The TM. So Deb Grantham is still our board president. She is burnt out, ready to retire. That will probably be happening at the end of her current session. I'm the executive director. I've been with NAMI for 2 years. We have a program manager now, which is exciting, Jessica McDonald. She's running all of our programs. She manages the volunteers. And our current board of directors that was just voted in is 13 members. Volunteers is the trickiest part of what we're doing. So a lot of the programs and supports that I'm going to share with you, we can't offer all the time. So they're hit or miss depending on when we can have volunteers that are already trained to facilitate those programs, deliver them. And Training to get new volunteers is really challenging because of all of the steps in the process. Sometimes it takes up to a year to train somebody for a class while we're waiting for training to happen. So it's difficult to just say, oh, we need to offer more programming. Jessica and I have been focusing a lot on non-signature programming. So NAMI National puts out programming, which is called their signature programming. That's what we're really well known for. That's what touches most people's hearts and draws them to NAMI. But we're doing a lot of non-signature programming on our own so that we can offer those supports and services without having to deal with the issues of volunteers. So I'll go through some of those. That's just where it volunteers. So our programming. So NAMI Family to Family has been like the staple NAMI program that most people know and love. Most people come to NAMI through this program. That's how I learned about NAMI. I took the Family to Family program about 8 years ago. It's 8 weeks long. Most of our Family to Family programs across the nation are being offered virtually now. So the good news is that if people are savvy enough, they can find a program that they can sign up for anywhere in the nation. Because every NAMI is its own 501c3, there's not a lot of like collaborative information. So you can't just pop on one site and go, where are all the Family to Family classes being offered? So you have to kind of do your own detective work. We've been averaging 2 to 3 classes a year. We have 5 trained volunteers. It takes 2 to deliver the program. So 2 people have to have the same availability, the same time, be willing to do it, and not have their family members be in crisis. So it's like all the stars and moons align, we give a Family to Family. It looks like we're going to be offering our next one in the fall. We have a wait list that people can join on our website, and we usually fill the class from the wait list. So it doesn't usually go out like that we're offering a programming because we already have a wait list full of people. NAMI Basics is very similar to Family, but it's specifically directed towards parents or caregivers of children age 22 or under with mental health issues. The great thing about NAMI Basics is NAMI National created a Basics on Demand. So this is a really valuable resource. If any of you guys work with parents of youth, they can just Google on NAMI.org, NAMI Basics on Demand. They can sign up for it. They can do it in 5-minute increments. They can sit down, do the whole class at once. It's just at your own pace. I took NAMI Basics on Demand, and they did a really good job of still connecting people on the support side of things. So throughout the course, you share your story, you type it all in, you can read other people's stories, and then you can interact with those people throughout the class. So they did a good job of trying to bring that component in, even though it's virtual and on demand. NAMI Homefront, again, is similar to Family, but it's specifically geared towards veterans or people caregiving for veterans. We offered one NAMI Homefront last year in conjunction with NAMI Syracuse. It was delivered in Bath. We had an amazing turnout. We had some technical issues with the hybrid nature of it, which were challenging, but got through those. And we have 2 new Homefront leaders training in August. And so we're hoping to offer a NAMI Homefront in the fall as well. And we're working with some local VA groups, like TC3 has an initiative to work with veterans on mental health. We're partnering with them and some other organizations that are local. Overwatch is a new program that we have adopted from NAMI North Texas. So Overwatch is a peer support program for first responders. We're pretty much mirroring their program, and we're in the very early stages of that. We just got a grant from the Legacy Foundation, and so we're flying some of their trainers up here who will be training our people who will be trainers. And so once we have local trainers, then they can train people to be peer responders. Let's see, Jessica wrote this. She's working on this. I don't know a lot about it except for what's happened. So we are working collectively with the Tompkins County organization. She didn't write which one it is on here, but Danielle is the name that we're working. We work with caregivers, so this is kind of a stretch for us, but we see first responders as caregivers, just in the same way we see coaches and teachers and Girl Scout leaders as caregivers. And Mental Health Association is also involved in making this program a reality. Right now, our most active and consistent programming is our support groups. We have family support group, partner and spouse support group. We just added a psychosis support group, and we're about to add a support group that's for NAMI staff. So there's a lot of NAMI staff that won't go to their own support groups because that would just be kind of weird. So we have a trained leader who's passionate about that, and he's going to be offering that support group. Family support group, we have 3 a month, partner and spouse. It's 2 a month, 3 when there's 5 whatevers. I don't know what day they meet. They added a 3rd one. And then the psychosis, I believe, meets twice a month. And both the partner and the spouse and the psychosis support group are maxing out most weeks. It's on Zoom, so there's a max. So we're looking to expand those programs. Community education is another big thing we do. NAMI Ending the Silence is a 50-minute presentation given to middle school and high school students. One of our 2024 initiatives is mental health for youth. So we have been working with schools to present Ending the Silence. We have 5 new people trained to deliver the presentation. There's a variation on that that's for teachers, and then there's a variation that's for parents. So one of the ways that we deliver this is in conjunction with Huddled Together for Mental Health, which is a new program that we've done for 2 years. It was started by Dave Archer, the former Cornell football coach. Huddled Together for Mental Health is a week-long programming initiative at colleges and high schools to promote mental health and mental wellness through athletics, but it's open to anybody. It coincides with the Solinsky Foundation, which was started a while ago when their son died by suicide. So they supply us with ribbons. Every game's a mental health awareness game. We offer Ending the Silence presentation and other NAMI type presentations during the week. And then the schools supplement with their own presentations and information if they want to. And as part of ours, when we go into the high schools, we do Ending the Silence for all the high schools. So last year it was Cornell and Ithaca High School. This year we're trying to get into all the high schools in Tompkins County, and we have Dryden and Lansing on board so far with IHS. So that's really exciting. NAMI in our own voice, we only have 1 person trained for that, and you need 2, so we're not very active in that right now. We have a helpline. The good news is 988 is doing such an amazing job that our helpline calls have gone way down. So we're kind of restructuring how we do it, but it has a separate phone number. People do call the volunteers that work the helpline are like the most amazing detectives ever. They will work relentlessly to get the information that the person needs. And it's just incredible, but that is a resource that's open to people. And then we have just general resources. We have a lending library. Statewide and nationally, we do a lot of advocacy work. We don't do a lot of that locally, but a lot of local people are involved in the state advocacy work. This is like an exercise that we do when we present, but you guys know that, probably have participated. It's a fun quote about stigma. We all know how that works. And then our contact information. But I want to save time for you guys to ask questions about programming and what we're working on, if you have any.
I have a question about the support groups.
Yeah.
Maybe you said this, but can a person join at any time, or are they in such a manner that you have to be chronological, so to speak?
Yeah, support groups are drop-in.
Okay.
So Jessica has done an amazing job of automating the registration process now. So you can sign up for a support group like 5 minutes before it starts, and you'll get the Zoom link for it. So people can pop in our family support group. Most people come 1 or 2 times, get the information they need and move on. In our spouse support group, people tend to stick around for a long time. It's like a closer knit support group, which makes sense. Spouses don't go away as easily as adult children that are in crisis. And then same with our psychosis. Our psychosis support group just started like a month ago. So we don't have a lot of data on that, but it's already maxing out. So there's definitely a huge need for people caring for people with psychosis. And it's like a special enough difference that it helps have other people experiencing the same thing talking about it.
Are the support groups, I didn't quite get this, are they in person now or online?
They're all virtual still.
Everything's virtual.
Yeah, we would like to move back to online, but
To in person, you mean?
in person, right? But all of our facilitators went through COVID with us and now they're more comfortable. The people participating came to us virtually. So it's hard to find new facilitators that are willing to do in person to try to reach the people that are obviously not reaching out to us that don't do virtual things.
Is there a difference with your hotline versus 988? Like, is your hotline more geared towards support for the caregivers?
Yeah, so we're definitely a warm line, not a hotline. And we, like, the phone isn't answered right away necessarily. We respond within 24 hours and it's mostly just a referral resource. Most people that call our helpline just want to talk and share their current struggle and story and often just filter into one of our support groups. If somebody calls us that's in a category that's not something that we do, we refer them to 988. But if you call 988 and you're a caregiver and you're just struggling with how to find support for your situation, 988 will refer you to NAMI. So.
In the schools, do you work with the mental health providers there, social workers, psychologists, so that there's follow-up after your presentation?
Yeah, when we do ending the silence presentations, we require that the teacher and preferably a social worker in addition are in the room and that we make sure that the students know who their resources are if it's just a teacher that's in the presentation room.
In the schools, what are you're finding? What are the students presenting with?
So the presentations that we've done at Ithaca High School were large. So we didn't get a lot of like questions and feedback from the students. We've done a few presentations at New Roots. The students are very engaged. I think that the biggest question that gets asked at New Roots, the teacher lets them write down questions on Post-its and hand them in if they don't want to ask them out loud. And the hardest thing is students saying, I have mental illness, but my parents won't believe me and won't let me get help. What do I do? And so that's like the most heart-wrenching thing. There's not a lot of youth support for mental health, like youth support groups. There aren't really any organizations in Tompkins County doing that. At New Roots, if a student goes and talks to the social worker, the parents get notified immediately. Whereas at IHS, you have 3 visits to the social worker before parents get involved. So students feel a little bit more free to go and have some initial conversations. And our youth are really struggling. It's a really, really hard place out there for them.
For Groton, Trumansburg, and Newfield, are you facing resistance with going into the schools there or just like?
No, we just started.
Oh, okay.
Hopefully they'll say yes.
So just what you were saying about there are very few resources for youth in terms of what, like support groups or.
Yeah, so if a youth is struggling with their mental health and they go to their caregiver and their caregiver is not going to support them, then they really don't have any resources that they can access. Like there are students that go to their social workers at school, and then once the parents are contacted, they're told they can't talk to the student anymore. And then those students don't have access to resources. Yeah, I know at the state level, there's some advocacy being done to change that. Like reproductive care, like you don't have to have permission for your parents. And so there are some laws that are trying to be enacted where mental health falls into that same category. But right now, that's not happening.
A point of clarification, the presentations at the high schools are just for the students. They're not presented to parents as like, here's some, signs and resources.
Right, so the there's 3 different presentations. They're all ending the silence. There's one for students and there's one that's geared for parents. And then one that's geared for staff and faculty. Last year when we did huddle, we did a virtual for parents and staff and faculty. We kind of did it all together and we kind of like merged the programs. Because it was our first year. And so we had several people join that. We're hoping that it'll be more this year. And then we're hoping to do ending the silence for parents quarterly. In a virtual setting, so parents can just jump on. But we can't like record those and have them open all the time, which is kind of a bummer. It's just how NAMI does things.
Sounds like there's a lot of really awesome movement and like additional supports and those kinds of things. Aside from more volunteers, what are other barriers, or are there like different things that would be helpful from the community at large to better support NAMI?
Yeah, I think resources are the biggest thing, volunteers. We're working together. The schools are just hard to get into. It's hard to get, even when we do it in the silence, like it's not a school-wide thing, or it's not scheduled so that every student at some point in their high school career is going to hear this information. It's just kind of hit or miss. They give us a time and a place, and if students want to attend, they attend. So we're working together with Sophie Fund and Suicide Prevention, and we're trying to get like a collaborative, like here's what we can offer as a community to you at the school. Like you don't have to do anything except for like open the door. And we're getting a lot of resistance there, so. But
Our mental health subcommittee recently had a town hall kind of style talk with representatives from all the school districts who were largely like the social workers and psychologists, and some of the nurses, and they expressed across the board interest in this. I don't know if you're connected with like Brandy Remington at BOCES.
I know that name.
I'll just grab your email and send you an email, because I know the school districts are, at least pockets within the school districts are very interested in getting more of this content.
Yeah, and I think the basics on demand, like if that information can get out to parents, like our parents being educated would be a huge help to the youth, right? Like if your kid comes to you and is like, I think I'm depressed, you know, and the parent says, no, you're not, like that's okay.
I wonder if you've been involved with trying to implement your curriculum into the health classes at the middle school level and high school, because that would be, that way every kid would get it, every kid has to read it. And
Yeah,
I know that they're always looking for a curriculum to add, and since this is so effective, that would be one.
yeah, I know in the Ithaca city, like they're all working on their own thing. So we're working with Carrie Burke.
Yeah.
Oh,
She's amazing.
Then she.
Yeah, so we have a mental health program for little bits up to age 3. So she's previewing that. We piloted it at the Montessori school and it went really well. But at the same time, there's other things that they're trying to work on. So there's just a lot of options and things that are happening.
And how long is it? How for the
The
presentation?
presentation is, the student one is 50 minutes.
Okay. So
The parent and caregiver one's a little bit longer, but the student one's 50, which is hard. It's not a period.
Right.
IHS.
It's a little bit.
It's a little
bit longer, but they could do it in 2.
We tried to do it in a period. It was like,
Yeah.
it's very intense, right? Our volunteers were like, whoa, that was a lot.
But if it was on demand, they can put it up.
Yeah, it's in the health classes that we've been doing it at New Roots.
Oh, okay.
As we're connected with the health
Good.
coaches there.
Good.
But even in high school, you only take health once.
Right.
So like,
Right, but at least it's a place to
exactly.
start.
And I think the middle school is really where we need to start.
Yeah.
And everything's getting younger and younger and younger. So if you get to high school and you don't know about mental health issues yet, like there's something wrong with what we're doing.
I'm curious, on like the preventative nature, if you do anything in regards to social media, which I'm hearing a big call from parents, and especially with like Surgeon General coming out wanting to put a warning on the use of social media for youth and its contribution to mental health issues. So are you involved in anything with that? And as young as like elementary, just it's becoming an issue.
Yeah.
Social media.
Definitely not something as a separate initiative. I mean, we share articles and things that come up from NAMI National and other places. I think National, NAMI's doing a lot more work on that.
I know it's something I'm hearing from like the people I work in the health planning council and like hearing from the community. It's something that parents are really struggling. And if they prevent their kids, they'll find other ways around it. So what's a healthy way and what's an age appropriate way? Like there's just so many questions around it. I know people are really struggling, but
Yeah, it's a huge problem with
yes.
the solution.
Yeah, it's part of the problem.
Any other questions or comments? Well, this was very informative. Thank you so much for your time. You're welcome to stay, but you know, you're welcome to leave.
Y'all look very wonderful, but I'm gonna leave probably.
Thank you.
Yes, thank you so much.
And is there a way we could have access? I mean, you went through things fast, but will you leave a copy of your slides, maybe with,
Are you okay with us sharing it?
Yeah.
Yep, Ron will email it out to everybody.
that would be great.
Great,
Yeah, and I think my contact information's on the last slide. So if you need to contact me, that's where you find me.
great, excellent.
Have a great meeting.
Thank you. Enjoy your trip.
You are allowed out without a call.
I know. I'm gonna get stuck in the elevator.
So are there any additions or deletions to the agenda at this time? Approval of the minutes. Have folks had a chance to look over the minutes, and if so, can I have a motion to approve? Sheila, is that, oh, I saw, oh, I don't have to write it down. I'm secretary for another board. And there was a second from you, Stu, was that right?
Give a second.
Okay. And on any edits or changes first, I should ask. Okay, so all in favor? Great, thank you. And then, let's see, what do we have here? Privilege of the floor. Any questions or comments from the board or guests? We don't have a guest anymore, but anybody have anything they wanted to bring up? Not right now? Okay, then next is.
So I had a question, I guess, that
Okay,
might as well go there. The discussion a couple of months ago that we had about people being on the subcommittees that worked for agencies. Has that been communicated to the people that are currently on the subcommittees? I ask only because James Beaumont was talking about the fact that they had discovered that he and Jeff could continue, as chairs. But it didn't sound like he knew that his current term would be his last. So I just wondered if.
I don't
Been any
believe we've talked, I haven't talked to anyone. I think we were waiting to get it in writing, and is that it? And then we did talk about grandfathering people in, but I can't remember for how long, whether it was for the remainder of their term or longer or what.
I don't think you can do longer than their term, because that would be
Yeah,
new.
no, I think where we were landing was on the bylaws needing to be updated to account for it.
Right.
I think that's where we landed. I'd have to go back to the notes to see exactly what you guys decided, because I'm not remembering at the moment.
Happy to create a draft for conversation. But I
Didn't
need this stuff. I haven't gotten anything from anybody, so I don't have.
we emailed it to you?
We're having that issue not getting emails. So
Was it maybe there was a little period there, but for some reason,
I'm sorry,
anything
we'll
from
get it.
Orange County was not coming through my email.
I wish that worked for me.
Started all coming through again, but it was like for some reason.
Okay, well, yeah, well,
Send it
yeah,
again. And if I don't see it in the next week, then I'll Reach out.
Okay, because we have the draft bylaws that you guys worked on, 18 months ago or so, that is pretty much ready to go. The only thing we were waiting on was the term limits, which the legislature did not make a determination on. So they're pretty much, we're ready to go, but this is a new issue. And also we need to include the language about remote attendance being acceptable for a quorum. So that'll need to go in there too, but I'll send you the draft that we have. And Karan, we have a template from the county.
Right, because I knew I did put it into the other template.
Yeah, so we'll send both of those things again, so that way.
And Sally had.
Could you send it to me as well? I don't have it either.
Yep, we can send you the draft. Yep, absolutely. All right. Yep, we can do that. Their
Okay.
terms won't be ending till the end of the calendar year. So.
Right, and I don't know whether they were coming up or not, but it was just.
Yeah, they're,
It just struck me as what James was saying. I realized it sounded like nobody had had any conversation with him, so that's.
yeah,
I think we were waiting to have it, in writing.
In writing,
So we
we
weren't
can
just like talking.
so the terms all run the calendar year. So, we have a little bit of
Yeah.
a window. So the summer is probably a good time to dig into them and, get them settled, and, because they do have to go through the legislature for approval once you guys sign off on them.
Okay, and our next meeting wouldn't be till September, right? So.
Correct. Yeah.
If there's anything I can help with, just let me know. Okay, so, board correspondence or announcements, there aren't any of those. And we've had our guests, so now we're on to the 2025 budget overview that Frank is going to go over with us.
Yeah, overview might be too strong a word. So, you all as a board don't have, authority over the budget, but you do have policymaking authority, and as we all know, money drives policy often, right, on what we're doing. So the way that we normally do this for new folks is to kind of talk to you about what we're doing related to our budget submission, because we haven't yet submitted it to the county administrator. So it's not done, but what I'd like to do is kind of just tell you the direction we've gotten from the legislature and county administration and kind of how we're approaching that. And then certainly, well, let me just explain the process for those that might be new. So back in April, we had to submit estimations for next year for our mandate accounts. And mandate accounts are those programs that the county has to pay for. They don't have a choice. For the mental health department, the only mandate account that we have is for the hospitalization for individuals under Criminal Procedure Law 730 that are deemed unable to aid in their defense. So these are the folks where two psychiatrists will do an evaluation and report to the courts whether or not the individual is able to aid in their defense. If they are not, they go to a hospital where they are not receiving what we would consider traditional mental health treatment. They are receiving services to try to get them to be able to aid in their own defense. So that is the goal of that service. It's not necessarily just treatment for the individual. So that's an important clarifying thing that we're trying to tell everyone that will listen, because some of our judges are still unclear and feel like that's a way for them to get people into treatment. And it really isn't. So when they go to the hospital, we are required to pay 100% of those costs. We have no control over those costs. We have no control over how long the people are in the hospital before they're released. We just get a bill. So it's a mandate and we have to pay for it. We are actually advocating. We used to only pay 50% of that, but 4 or 5 years ago, they changed it at the state level that the counties pay 100%. So we are advocating to get some of that reduced because that number has grown astronomically. We used to only budget about $400,000 or $500,000 annually and often didn't even hit that number. The last few years, we've been at 1.5 million. Whoa. So it is a significant cost to the county, in part because we're paying 100%, because judges are sending people for these for the evaluations and sending them to the hospital. And of course, we all know the acuity of mental health issues in our community has risen. So that's our mandate account. We have to estimate that, you know, a year and 3/4 ahead of the end of that budget year. So it is a rough estimate. But we submit those, and then the county administrator does some math around some estimations around sales tax and, you know, some of the other revenues that the county receives, and goes to a retreat with the legislature, at which point they make a decision on what the recommended target goal for the tax levy is. So based on what the county administrator tells them about what they would need for maintenance of effort, they go and have some conversations and they set a number. This year, the number for maintenance of effort was a 5.4, I think, tax levy increase. 5.9 and maybe 5.9% tax levy increase. So that accounts for wage growth, revenue estimations, all of the things that impact the budget. The legislature gave instruction to the county administrator that they wanted to be at a 2% tax levy increase. So essentially what that results in is cuts to the county share of the budget. So the next phase in that is the departments are then tasked in the month of June, which is right now, in submitting our budget to the county administrator for consideration. We were directed to submit 2 budgets. The first one was a maintenance of effort budget at that 5.9%. So essentially just keeping everything the way that it is. And also one that was at the 2%, which amounts to a 5% reduction in the county contribution to each department. So for our department, that's about $300,000. Right, that's the entire department of whole health that we had to find in the budget. The good news is we are going to be able to do that without impacting any currently filled or expected to be filled positions, or reducing any programming. And the way that we're doing that is in large part, we have 2 community health nurse positions up on Brown Road, one in children with special care needs and one in community health services, that have been held vacant for more than a year because of recruitment challenges and or program needs. So we've seen a reduction in service provision in children with special care needs, in part because we had fewer kids, but now it's because we have fewer providers. And in the community health services side of things, they've been really reevaluating the maternal child health programming to try to see how we can better serve families that are navigating pregnancy and newborns. And we had not yet got to a place where we were prepared to begin recruiting to try to fill that position. So those 2 positions will eat up a bunch of it. And the rest of it will come from lines around travel training and some program expense stuff. So places you might expect it to come from. But thankfully, that will not result, as I said, in any positions that are currently filled or that we expected to fill being eliminated, or any programming shifting. So from that perspective, both the maintenance of effort and the reduced budget will have no impact on what we're currently providing. In fact, we are still evaluating expanding. We are always looking at expanding the children's services in the schools. And we're also looking with other funding sources, state funding sources, to expand to a 3rd care team, like we've talked about before. So there is, even in this more austere environment, there is still opportunity for us to grow services using other funding sources besides county dollars. So generally speaking, where we are from a budget perspective is essentially maintenance of effort in both scenarios. You know, we're hopeful that when it all kind of shakes out in the end, that there will not need to be as much of a reduction in the budget, because revenues or other sources of funding become available to apply to some of those areas. I think the legislature, obviously, you guys saw with the Ithaca City School District budget, there's a lot of pressure on taxpayers, right? And so I think the legislature is trying to be more or is trying to recognize that in this budget cycle. And they have also committed to being more disciplined in the process as well as we go forward. Some things of note included in this tighter budget. There's not a cost of living adjustment for the county sponsored programs through the Human Services Coalition. So those folks would be flat funded. Some of those are organizations that are, they're all doing human service work to some degree. So that impacts the people that we serve, the people that are serving the people that we serve mostly because it's, what ends up getting hit is salary increases. So there are some places in there where, the austerity, it does make for some difficult decisions as we move forward. None of this, so all that being said, our budget is due Monday. The budget with the reduction. So Jeremy and Porter and Karen Johnson are putting the finishing touches on that. It will be submitted on time. And then it goes to the county administrator. And she looks at all of the budgets. And we meet with her in the month of July, department heads do, to kind of explain our budget and what's going on there. We're scheduled to do that, Harmony, Brenda and I, on the 30th of July, I believe. So we're at the tail end because I'll be going on vacation shortly. So we'll present that to her, and then she goes through everything that she's received, both from departments as well as what she's learned about the other factors that impact the budget. And she is required to submit a budget to the legislature by early September. So in early September, her budget goes out, and that's when it becomes public. At which point you would be able to click through all the different line items to your heart's content, if you so chose, to see, where things are. Because it'll be on the county's website. Then once that's submitted to the legislature, they begin their process. And they hear presentations from all the department heads. They're going back to last year, it was only folks with OTRs, but this year everyone's going to give a presentation. And they are looking for more insight into the operational budgets of the department so they can understand better where the dollars being spent are going. So it will be a bit more intensive review from the legislature, which I think is a good thing. And then once those presentations are done, they go into voting meetings where they add or remove things from the county administrator's proposed budget. That generally happens late September, early October. And then once that's done, the adding and the subtracting by the legislature, there is a new then proposed budget that goes for a public hearing. So anyone can come give input to it from the public. And then finally, the legislature votes in November. So we're talking about this on June 30th or whatever today is, and it won't be, July 1st, you're right. We're in July, July 1st, and it won't be finalized till mid-November. So it's still a lengthy process. And as I said, it started in April. So this process runs from April to November for us. It's almost a full year process. So a lot can change both in what we know about projections around revenue and things happening at the state and all of that stuff that can make impacts along the way. But ultimately, we won't know what's finalized until November comes. So that's kind of the process and where we are. We do have a couple of OTRs. So OTRs are over target requests. So if we want to ask for something above and beyond what we were given as our target county dollars, we can ask for an OTR. One of them was presented to you all, which I need to follow Jeremy on, was presented to you all by the suicide prevention folks at your last meeting. So that will go in as one. We also have the continuation of the care teams. Is an OTR that was funded with one-time 3 recurring funding. So there's another year of that. So that will go in there. And the outreach worker program, which we have not yet launched, but was multi-year, one-year funding, multi-year, one-time funding as well. So we will have those 3 OTRs that will go along with our budget. I'm confident in the care team one. I think that is a given that that will continue to be funded. I think the other two are a little more up in the air based on, you know, kind of the situation where we are. It'll really depend on what type of flexibility the legislature has when they get to their decision-making points. So I think that's where we are. Just wanted you all to know if anyone has particular questions about anything that we've submitted, we can certainly answer. We can get you that data. It doesn't become public until the county administrator pushes it to the legislature, but we absolutely would be willing to share with anyone individually if you had a particular line item you wanted to see.
I looks like, I think Stu raised his hand first and then, Jessica.
My question is around substance use in the community and the informationally, whatever happened to the funding for the place on Trip Hammer. And the county has provided some money over the years for ADC. That's also money that perhaps is out there, not out there. You know, what's any updates that's going on in that?
Sure. So the Alcohol and Drug Council, the three RFPs for prevention, for outpatient, and for the detox stabilization have been approved by Oasis, have been approved by Harmony and and are now with county finance. So those should be posted soon, any day. I was hoping before the holiday, so maybe in the next day or two, but certainly within a few days. So those will be out and folks will be applying for those. Those are all state dollars, except for a small little pocket of, I think, about $50,000 that we had that the county had allocated for outpatient and prevention support that are tentatively included in the RFP. It says may be available, so it really depends on the applications that we get, but it's a relatively small amount of money, and that is in Target. So it's already accounted for in Target. As far as the monies that were given to the Drug Council, they had received funding over a 3-year period, a descending amount each year for startup costs, with the idea that, you know, day one, they wouldn't be able to open fully, and so they needed some support. That money is gone. Those 3 years of funding is gone, and there's not new funding expected to follow behind that. So the RFPs that are out are solely for state funding that comes through the board and the department for them. So that's where that stands. That's kind of a separate process because it's state funds that are there. And as soon as we can get a vendor, then, you know, we'll contract with them. And as soon as they can start, they'll start.
That's still the issue with the Trip Hammer, as I call it.
Correct.
We don't have a vendor for that.
Correct. Yeah. The RFP for the detox stabilization includes the building as well as $600,000 annually of operating costs from the state.
Jessica?
So obviously the whole health department's in a unique position that there's some insurance money coming in for some of the fee for service services that are being provided.
Mhm.
Would we be able to have someone from like the billing department, like come and speak to us? Like I know we have the like quality assurance folks come. But it would be helpful, at least to me, to meet with the billing folks and see how they are kind of optimizing billing and how they're approaching billing.
Yeah, Jeremy Porter, our fiscal administrator, would probably be the appropriate person. You can have a one-on-one conversation with him if you'd like to have those questions answered, and or he can come to the board. I know it's some of it isn't super exciting for some folks, but
Not everyone loves CPT.
yeah, we could certainly do that. We we do obviously try to maximize billing everywhere that we can. One of the biggest challenges is our costs of staff are rising and are going to continue to rise. So we're we're trying to figure out how to balance that against caseload numbers and all the things that go along with it. So the county does subsidize the clinic pretty substantially because of that, and also because we are the safety net provider, and we try, one, we don't turn people away, and two, we also try not to, we try to be judicious in our discharging of folks, right? The new changes where we could do rapid intakes for folks that hadn't been gone for more than a year, I think it is, has really helped on that front. But it is still, we try really hard to stay engaged with people, even when they're not trying so hard on their end. So that creates a challenge. We have about a 30% no-show rate still that we've tried to adjust for many, many years. And they're really just, everything we've tried just hasn't put a dent in it. But yeah, we do try to be as creative but legal with our billing coding as possible. So yeah, sorry, that was a long-winded answer, too short. You can absolutely talk to Jeremy and or the billing folks, or if there's interest from the whole board, I'm sure he'd be happy to come and talk here as well.
I'd be interested in that subject too, because going back a number of years, it was a 40% no-show rate just for the Medicaid clients. So you're saying it's 30% for all?
Yeah, I think it's roughly 30%, it goes, yeah.
It's actually not, yeah, it's actually not terrible.
Yeah, it's, there's a lot of things that we have to, productivity is always an issue as well, right? You all, those that were around when I first came on board will remember that I was not making a lot of people super happy because I was hammering on productivity because we were so far in the red with the budget. But that's hard when people are dealing with other people's trauma all day long, and what is an appropriate push for how many people you need to see in a day. And, we heard from Family and Children's and the way that they work, and their caseloads are smaller, but their wait list is also significantly longer, right? So as a safety net, trying to balance all of those things to be financially sustainable as we can be has been a challenge. We have been under budget every year except for the first year that I was here. So we fixed that problem, right? So we at least got to a place where we were estimating effectively what it would cost the county to do what we're doing. But yeah, it's expensive to run a clinic. And it's super challenging in these times when there's so much demand, and the acuteness and all of the trauma that our folks are hearing all day long. It's so hard to understand how hard you can push people to, see as many folks as possible without burning them out and, creating other challenges because then you don't have staff. So yeah, sorry. It's something we're talking about all the time, every day, trying to balance what we should be doing, but we can certainly have him come, and it would be helpful. Obviously, it's a big thing. So if you have questions, we can get them to him and he can prepare something and bring it in for you.
I had a general question. When our legislative liaison is here, Randy, he often talks about, and I bring this up because I just need a little more clarity. He often talks about this money that's set aside, more or less the rainy day fund for the county, and speaks, it seems to be his opinion that this is money that should be utilized in tough times, or if there's a need that's not being met. What is the general thought around what that money's for, and in what cases is it accessed and used?
So that's a really good question. And the fund balance, which is essentially what we're talking about, which is unallocated resources that the county has either collected through taxes or received in some other way, that have gone unspent. There is a lot of conversation at the legislature about what the appropriate level for that fund balance should be, the rainy day account, for lack of a better way of describing it. There are the folks that are of Randy Brown's opinion that we should be spending that, and that number should be much lower. And there are folks in the legislature that think it's just fine where it is and it should be kept there in case, something ever happens that they need it. So the short answer is Randy feels very strongly about that, but I don't think he's in the majority. on it. I know that he is advocating for a lot of different things, particularly around children's services for the community, which is great, and we support him in that. And, you know, perhaps the legislature, you know, will come to that opinion. They may use fund balance. They sometimes use fund balance so they don't have to raise the tax levy. But the thing about the fund balance is it's one-time money. Right? And you don't want to spend a lot of one-time money on recurring costs because that just builds a hole for you in the future because the one-time money will run out, but those recurring costs will continue on. So like the care team, for example, they use one-time funding, but said they would fund it for 3 years as kind of a pilot to see how it goes. When we get to the end of that 3 years, there's going to have to be a decision about, do we continue it? Or do we put it into target and make it sustainable moving forward? So that's part of the conversation that goes on with the legislature. But Randy is he's a strong advocate for spending that fund balance on things that he thinks are very important right now and are rainy day things that should get attention. But it takes 8 of the legislators to do something like that.
The state require, oh, I'm sorry.
What is the plan for this budget, upcoming budget year? I mean, are they planning to put more money in the fund balance? Because I've read that as well, or are they planning to keep it steady? Are they planning to spend any, or is that?
Unfortunately, I'm not the right person to answer that question, Jan, because I'm not really sure. And honestly, I don't know that they are because and that's not a bad thing. It's just that as the budget process unfolds, they often use some of that fund balance to do some of the one-time things that we talk about. And so they may dip into it if they need to, based on what it is they want to accomplish next year, or they may not. And so there is a policy right now that they've established about what it shouldn't go below. And it's a pretty high number. I don't, 18%, 20%, something like that. That they follow.
20% of what, of the total budget?
Of the total county operating piece, not the total budget, because much of the money comes from other sources. I think it's of the budget, but it's a big number. And so some of what they've done too is they can partition off some of that fund balance. So the Center of Government building, for example, I don't know if you guys have heard about that, but they're talking about building a building over on I think it's the corner of Tioga and such, on property the county has bought, to bring the downtown county departments all into one building. Because right now they're kind of scattershot in many buildings, some of which we pay rent on, right? And so I believe they've set aside some money for that. I believe they've also set aside some money for a new public safety building as well. Because we know the jail is in need of upgrading. And so those types of things, they can set that money aside and say, okay, this is earmarked for that project. It's still there. It's still fund balance. It's still their money. And I think technically they could go and say, oh, we can't do that. We need to move it over and use it for something else. But those are the kind of things that they do to earmark those funds so they know they're there for those future projects too.
Does the state require a certain minimum?
I don't think the state requires it now, I'm getting a little bit out of my scope here, but I think it really reflects on your credit rating.
Yeah.
Right, so if the
Moody's
county
requires.
if the county doesn't have a certain percentage, it would affect your bond rating, and then when you borrow money, it would cost you more to borrow it. So maybe there's a state, but I think the thing I normally hear about is the bond rating and that it could negatively impact it. I think, quite honestly, I remember hearing that it had gotten so high that it was going to potentially negatively impact the bond rating too, because then it demonstrates you're not spending, everything that you're taxing kind of thing too. So I'm not an expert on any of that stuff, so please don't quote me on it, but I know the legislature has been talking about it at length, and they're really grappling with, there's 14 of them, 15 of them. And you're grappling with how big your savings account should be, right? Every one of us around the table probably has a different number in our savings account because we have different levels of, risk that we're willing to tolerate, those kinds of things. So that's really the process that they're going through, is trying to figure out what that should be for the county.
Yes.
I think just informational, talking with Randy and a couple other legislators, if I'm not mistaken, it's something like $56 million that's out there. And yeah, Randy would like to spend that, a few other folks, but I too look at that was, okay, that sounds like a lot of money to me, but where do you how much do you take it down to? They've had this built up over a number of years. And again, if I'm not mistaken, it's the highest it's ever been. So I think it's not necessarily a dilemma. It's kind of a delight to have that much in reserve. But my sense is that they continue to talk about it, and I get what Frank gets is they want to hold on to it, and if we have something in particular that we think is a great idea to utilize that, I think they're open to hear that, but
Yeah,
they keep
I understand.
piling it away.
Yeah, I do understand that.
I hope it's invested.
Mhm.
That's another question. And I know our new finance director for the county is looking at ways to maximize that. She gives a presentation on where all the money is and how much interest it's earning. And unfortunately, and again, not my area of expertise, but governments are limited in what they're able to invest in because it has to be extremely low risk because it's taxpayer money that you don't have any tolerance for loss almost. So it limits. And of course, that brings down the interest rates that you're potentially going to get to. But I know she's been looking at ways to advance that
Yeah.
as well.
4% on 56 million, is still quite a
Yeah, as
bit.
well as balancing things like, because I know I've been dealing with one of the school districts, balancing with where you're doing it, you may be able to get more interest if you're with, ING or some national whatever, but there are local banks that provide local jobs and, so there's all kinds of balancing that happens with a whole lot of different interests, and
The county
you
is.
can't risk the principal at all.
And the county is committed to using local institutions. So I think if you look at where their investments are, it's with local financial institutions.
I think Randy had said to me that he was getting 8 months ago or so, about 5%.
Any other questions or for Frank out of his area of expertise? Sorry about that, Frank.
No, it's okay. I learn.
So we gotta leave that.
Yeah, I learn every year something new about the whole process. So, what I can say is I do think county administration has taken some budgeting tools that will help limit the amount of fund balance growth in the future too. Things like we're now budgeting for a vacancy rate. Right, there's an expectation that not every county position is going to be filled every year. And so that's a cost savings. And traditionally, up until last year, we never budgeted for that. We just budgeted as if every position was going to be filled for the whole year. And that's just not a reality. So there's savings to be had there. So there's tools like that in the budget. One that helps us not have to cut as much when we get to these austere times, but those are also dollars that had to be collected in some form or fashion and went unspent. And those unspent funds is what ends up, creating the fund balance and its growth. So I think while they're at the same time, they're looking at where that number should be, they're also through county admin looking at processes in the budgeting to try to, again, help us from having to cut things, but also will start to, regulate how much that fund balance grows year to year.
Hey, anything else? I want to remind folks that September, if all things come together, that's when we had talked about doing some homeless services presentations, just so you're aware. I can't guarantee that everybody's schedule will match up with that, but That's what we're thinking.
And it's not the first Monday in September because of the holiday.
Yeah.
Labor Day.
That's September 9th.
September 9th. And you'll be able to let yourselves in.
But not the people that didn't come tonight.
Oh, that's true. That's true. We gotta get.
I have a motion to adjourn. Okay, we got all set then. Thanks
Thanks, everyone.
for your August.
Yeah, have a good summer.